Hi there, this is just the interpreter, making sure sound and visuals are all good.
How does it sound?
Sounds good?
Perfect, thank you.
Wonderful, thanks, Scott.
Welcome, Scott. I'm wondering if you could tell me how you pronounce your last name, please.
Sure, it's McAfee.
McAfee. Okay. Thanks.
Yeah, I tried to pronounce your last name earlier, but I couldn't get it.
It's challenging. Lots of extra letters. Muzechka.
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 Yeah.
Where what's the origin of that name?
Ukrainian.
Nice.
I think so.
It's a little short on vowels, but I guess sometimes Y applies.
Yes, absolutely.
Just doing a sound check. It's Heather here, the interpreter.
Hi, Heather. Welcome.
Perfect.
And Martha, is the sound check from Darlene in the next boardroom.
Sounding good, Darlene.
Excellent. I'll mute myself now for now.
Hi, Darlene. Nice
Hi,
to-
Scott. How are you doing?
Nice the name. Great.
Yes, wonderful. I'm so glad you're here. Okay. Over and out for now, Martha.
All right.
And Scott, I know that you've got whatever time you want pretty much. I sent you the note because I had originally said 8 or 10 minutes, but you're the featured speaker this afternoon, so have at her.
And after my bit, what is it? Conversation?
Breakout rooms actually. So there'll be
Okay.
nobody in the main plenary. We're going to 4 breakout rooms, and if you stay with us, you will be assigned to one of them.
Oh, awesome. And so, yeah, so I won't be too long, but I think that that'll be great. I'll come to the breakout rooms as well. You guys are my whole
Wonderful.
afternoon.
Wonderful, grand. Thank you,
And,
Scott.
So we'll, Scott, have you starting shortly after 2. I'll introduce you
Sure.
and make note of the 2 discussants. And then when you're done, which is around 2:30 according to the agenda, but then we'll have an opportunity to hear briefly from Ed and Mark, and then we'll move into our breakout rooms.
Yeah, so after I'm done, is there a way to have is there a Q&A or anything like that you want me to do? Or just go right into the
Yeah,
discussants?
we'll go to the discussants, and then if there's time there for a bit of reflection amongst the 3 of you, but
Okay.
the discussion will focus in the breakout rooms.
Okay, that's fine. Cool. I never heard the word discussants before, but I like it.
It is a useful word.
Am I too bright on the screen?
No, you're looking good. If you have the latest version of Zoom, I'm told you can go into your video settings. And if you go to choose a video filter or video settings, you can adjust some of the lighting
Okay,
there.
good to know. I put a deeper I can put a mustache and a beard on.
Apparently you can. Lipstick and eyebrows.
That's awesome.
I've tried it. It doesn't work all that well.
I was going to say, please don't.
Hi, Scott.
Okay, I won't. I'm just joking.
I was joking too, Scott.
No, we're all good.
I was actually on a call a couple of weeks ago and we had a cancer survivor, and she actually very much liked the eyebrow filter.
Yeah, I imagine.
Whatever gives you a boost, I think, is just fine.
Yeah, a lot of members of our council had the Bernie Sanders background of him just sitting in the background, kind of behind on their shoulder for a while after it was popular after the inauguration.
Oh, yes, yeah.
It's funny. It was like a little devil on one side and a little angel on the other one, but someone had done that. Like, it was a pretty good mock-up. And so, Martha, during my presentation, just going to be all faces and no background. Is that right?
That's right. We'll have a spotlight on you to facilitate for the live stream, as well as the two interpreters. They'll swap in and out.
But I'll be able to see everybody else.
Yes,
Okay, awesome.
there's a number of different views that you can choose. And usually it's in the upper right corner.
Yep, I got it. It's nice to see, make sure that people are appreciating the humor and understanding.
Well, I did many a teleconference in the pre-2000 period, and I have to say, it is actually quite nice to be sitting virtually around a table and have the opportunity to see people.
Yeah, I probably do. I'm going to say 5 to 10 Zoom meetings a week. So it's a great tool, and I think that a lot more authentic communication and a lot more engagement.
And we're developing a body of knowledge around how to function in this platform and other virtual meeting platforms. So it's there's some
Yeah.
great opportunities.
There's some good points this morning around the kind of the digital divide and how this is being if this is the new normal, then what should the support for the new normal be? So I thought that was pretty insightful. And it could, but it really impact, rural versus urban and people that have access to devices or high-speed internet or data. So I think that there's some new kind of, table stakes when you come into these conversations. That's good.
Okay. Well, we're 1 minute to launch.
Sure.
Welcome, everyone, to Policy on the Rock 2021. For those of you who joined us this morning, thank you for joining with us again this afternoon. And for those of you who are new to the session today, welcome. We have a keynote speaker joining us, Scott McAfee, and also we'll have two discussants, Ed Sodden and Mark Nichols. Ed is with the Citizens Voice Network, and Mark Nichols is with $15 and Fairness. We will have Scott open the session, and then after his presentation, we'll have Ed and Mark. Should time permit, we'll have a little bit of a chat between the three panelists. We also are doing things a little differently this afternoon. We'll be moving into small breakout groups where you'll have an opportunity to share and reflect on the topics we've heard today. This morning, we heard from Sister Elizabeth Davis, Norma Alford, Daphne March, also Sarah Crocker, Ivan Emke, and Debbie Wiseman, who spoke about small things that can lead to great change, looking at the impact of digital technology and access to health, and also looking at how we can use data and personal lived experiences to address inequities and issues in our communities. So lots of things to think and talk about on this day. Before we go any further, I would like to ask Darlene Scott to provide a brief welcome from Vibrant Communities. Darlene.
Darlene, you're muted. Still muted. There you go.
Should be good to go there. Hi, yes, and that is my job. My name is Darlene Scott, and I work with Vibrant Communities at the Community Sector Council. It's really exciting to have a policy discussion about poverty reduction. Every province in Canada actually has a poverty reduction strategy prepared by its provincial or territorial government. And if you want to read any of them, by all means, go online to Vibrant Communities at the Community Sector Council website. Every one of them is up there. And as we all know, some of them are getting a little bit older. And in our province, we understand that a new one is coming. So everybody is really very much looking forward to that. Additionally, the report that Scott McAfee is going to refer to about poverty reduction strategies is also online at our website. So I want you to enjoy the session. Thank you so much for taking part in this policy discussion. And when you go to the breakout rooms, don't be shy. We are really looking forward to hearing your recommendations or observations. So welcome to Scott. Welcome to everybody who's with us. Thank you, Martha, and let's get going.
All right. Thank you, Darlene. As you mentioned, and as we've heard, Scott will be speaking to us from Fredericton. He's the chair of the National Advisory Council on Poverty. Please welcome Scott as he speaks to us about the power of poverty reduction strategies in Canada. Welcome.
Awesome. Thanks so much for having me. Great discussion this morning. I was really pleased when Darlene contacted me. I think it was the day after we released our report, Building Understanding. That report is really a progress report on where a poverty reduction strategy can take us. When I was thinking about today, I was thinking about how we do this in a way that's, maybe from a collective impact lens. And I know that I saw in the Community Sector Council website, you guys have collective impact up there. So when I think back to the National Poverty Reduction Strategy, I think of three big things and kind of five things total of that really line up with collective impact. The first one is that there's a common goal. And it's set out in legislation. So the common goal is a reduction of poverty in Canada by 20% by 2020, and 30% by 50% by 2030. And that lines up with the Sustainable Development Goals from the UN. I know we had heard earlier today that other things are going to line up with the UN as well. So that's great. The other thing that the strategy did was set out a measurement of poverty. If any of you know that you've been in this business for a while, that there's kind of 5 measurements kind of currently with poverty: LICO, before and after tax; LIM, before and after tax; and the market basket measure. Well, in 2018, when the poverty reduction strategy came out, they established a national Canada's official poverty line, which is the market basket measure. And that's also put in legislation. The other pieces that enable a poverty reduction strategy to be successful is some oversight and some support and some that continuous communication. So that's third thing of collective impact. But the piece where that is, so as a council, there's 10 of us made up for people from coast to coast to coast. There's 2 people appointed from persons with lived experience. Once we met, we discovered that there was more than a few people beyond that had lived expertise, so experience that you could share. And so we've stopped using lived experience, and we only use lived expertise, because if you're going to bring something to the table, then it is expertise. Other people bring academic credentialing, and so but if you're bringing lived expertise, then it's well worth its weight. So we kind of act as the backbone organization for the plan. We have a secretariat that supports us in Ottawa. And the last thing, and we have 3 mandates. One is to report progress annually on the movement towards the goal. The second one is to provide independent advice to the Minister of ESDC, so Minister Hussein. And the third one is to have an ongoing conversation with Canadians about poverty. We started that last year in hopes to inform ourselves. We went out on a learning tour. We had 8 weeks of learning planned. It started on March 1st. Maybe I'll save you a little bit of spoiler warning. On March 13th, it ended. Global pandemic, everything shut down. So we had to kind of figure out how we're going to do this in a different way. We went to look at the data. You guys mentioned data this morning. We weren't able to disaggregate it down to a level where we felt comfortable making recommendations based on the data solely. So we had to we used the engagement we had with about 250 people over those first 2 weeks, coupled with the data, and we identified some data gaps. In the report that Martha alluded to, or that we talked about earlier, that there is that Darlene talked about earlier, there's some calls and some recommendations around that report, and I think that they're valuable. Poverty in Canada has been going down. In fact, the Canada Income Survey got released last week. Poverty in Canada is down to 10.1%. Median income in Newfoundland has gone down. It's not going up. So that's a challenge. But overall, in Canada, poverty has gone down, but not equitably. So there's some areas where we have to continue to work on the things we're doing, and then areas we can focus on. Affordable housing, homelessness, food security, as we heard this morning, health equity. A lot of these things, early learning and childcare, literacy, numeracy, they come up a lot, and I think these are big pieces to put in place. When you build a poverty reduction strategy, the good news is that these can all be a part of it. It doesn't only have to be about one part of it. It can be about, when you talk about poverty, you've created a big common denominator. And that common denominator can carry a common agenda with lots of mutually reinforcing activities. So all the things that you guys do daily to make people's lives better are the things that can go into a poverty reduction strategy. When I look back at your 2005 strategy, there was quite a bit of engagement, but it was a government strategy. It was focused on activities that the government could put forth. Previous to being the chair of the National Advisory Council, I worked in New Brunswick on their poverty reduction strategy for about 10 years. Engagement is a big piece of it. I think the process of poverty reduction, of developing a poverty reduction strategy, although it is hard to say, is almost as important or more important than the actual final product. How you do things matters. Why you do things matter. So if we can engage the people that are living the expertise, that have the lived expertise of poverty in the process of developing the program or product or process that will make their lives better, we should. I think we have to. And really put them at the center of the conversation, because they're the ones that have the most skin in the game. They're the ones that have the biggest impact. I think that if we have a society without poverty, we start to take care of each other more. There's a lot more, if we take care and care for each other, that's a whole different thing. When I looked at the kind of foundational pieces of your poverty reduction strategy from 2006, I guess, there was 8 pieces that is really, really kind of aspirational, and then they're awesome. Other areas that access and coordination, stronger social safety net, improved earning incomes, early childhood development improvements, better educated population. Those are all awesome. Like, who's going to say no to any of those? Those all sound great. How are we going to do them? That's the key. And I think by engaging with people that are living the expertise or living the experience and have the expertise, then they'll tell you how that they can be supported to move these things forward. I know that they originally the plan had committed to annual reporting in the legislature and biennial, which is another crazy word. So every 2 years, written reporting. But also, they also talked about that income levels would increase over time, and the adequacy of income support. In the 2019 former Lake Caledon, now Maytree report about social assistance in Canada, it looked like levels have actually gone down, gone up for single employables, but gone down for personal disability. But they pretty much leveled off. And the same thing it's been pretty level over the past 10 years for persons with children and families. So I think there's some work to do. I think that you guys have obviously, like, look at the room. You have a great cast of people to do it with. And I think that you've engaged in the right things. This morning, talking about the health accord. So the way you talked about the health accord was really important. And that fact, it was an accord. So there's agreement among all. So how are you going to do it and what you're going to do? And everybody has a part and everyone's in agreement. That's important. And that health belongs to the people. Healthcare belongs to the system. So how are we able to motivate the system to take care of the people? You talked about food security. I thought that was great. The Hunters for Hunger program, and that kind of the ongoing battle to get good high quality protein. I forget the amount of moose that each person in Newfoundland could have by the harvest. It was significant, and the kind of that long battle. So thank you for battling. I think that you've gone forward and you've made a big difference in people's lives. And I think that the inclusion of First Voice. So if we can keep First Voice first, then I think we're well on our way to a positive poverty reduction strategy that can have a big impact. Thanks.
Thank you, Scott. Really appreciate your providing us with the big picture. The long view is really important, and as well as the close-up view. And we had some opportunities this morning, as we will right now. I'd like to call upon Ed Sodden, our first discussant for this afternoon's session. Ed is from the Citizens Voice Network, which I mentioned, and he's going to speak about what is happening on the National Farmer Care Front. And after Ed, we'll hear from Mark, and then we'll have a chance for a bit of discussion amongst our three panelists. So Ed, welcome, and over to you.
Thank you. Hope everybody can see me and hear me. I've been advocating a universal national pharmacare program for several years. I can go back to 2003, and I've written a number of articles, and I've written a number of I just gotta press this. There we go. Sorry, the high technology these days. Anyways, going back to pharmacare, I've been advocating for a universal single-payer pharmacare system since 18, almost 20 years ago. I think Newfoundland Labrador will benefit from it, as well as other parts of the country. The thing is that some of the provinces and territories have programs. Some are more generous than Newfoundland Labrador. Some are not as generous. The thing is that I believe that all Canadians, including the people throughout this province, should have access to a comprehensive, accessible, portable, and public pharmacare program. Now, as I speaking, I did a little bit of research about the recent federal government report called Prescription for Canada, Pharmacare for All People, or all Canadians. And it was headed by Dr. Eric Hoskins. which you may know of. He used to be Minister of Health in Ontario during the previous government. And they came up with some big facts. Right now, there's over 100 public drug plans, federal, provincial, territorial. Now, if we had a universal pharmacare program to include every single Canadian, whether they be on the public, any kind of public coverage or private coverage or no coverage, the government parliamentary budget officer said that by merging all those public drug programs, they can reduce prescription expenditures by approximately $4 billion. Now, as far as the public drug programs are concerned throughout the country, including Newfoundland Labrador prescription drug program, all the governments in this country are spending $36 billion. That's the second highest health expenditure in the country. The first, or the highest, is hospital care, which is obviously covered under the Canada Health Act. The thing is that with this pandemic, everybody's becoming aware that there are a lot of gaps in our social safety net and our prescription drug programs. A lot of people have lost their jobs, and as a result of losing their jobs, they lose their medical benefits, like Great West Life or Sun Life or what have you, and they're without anything, or they have to wait and apply for the Newfoundland Labrador prescription drug program to see if they qualify for the Access Plan or the Foundation Plan or the 65 plus plan. And there's so many gaps, and it's sad, and it's to see our fellow Canadians, Newfoundlanders, Labradorians falling through the cracks. It's one thing to try to cope with unemployment as well as the pandemic, but it's also, when you lose your private medical benefits, especially if you have a chronic health conditions or disability, it's really rough for people. And I know in Ottawa, the opposition, or some of the opposition parties, introduced Bill C-213, and of course the government said no. I was disappointed about that, but I know the federal government is committed on their own time schedule for national pharmacare. It's just a matter of time, I believe. But I think we really need it now, just like basic livable income. I think at the end of the day, once everything gets all sorted out, and once pharmacare is implemented, God willing, we should be able to go to our pharmacists and use this instead of a MasterCard or Visa. It should be covered under the Canada Health Act, and I could see it coming. It will be implemented. It's just a matter of time, I guess, and hopefully we'll have it soon, and so nobody would have to do without. And I'm really encouraged with all the positive feedback I've received from people throughout the province and as well as throughout the country. I even got responses from faraway Yukon. The Minister of Health in Yukon, Pauline Frost, responded to me a few years back about pharmacare. And there are a lot of people. The support for pharmacare is increasing. It's in the 80-90% range right now, and I can see it happening. We just need the government to go the extra mile and implement pharmacare for all of us. Thanks.
Thank you, Ed. Always a pleasure to
welcome.
hear from you. You've been a longtime advocate on this important issue, and it's great to see you here once again on this virtual platform.
Thank
I'm
you.
now going to ask Mark Nichols, our community organizer from $15 and Fairness. Mark is going to speak on poverty reduction and a fair minimum wage. So building rather nicely on Ed's last comments. So Mark, over to you.
Thank you. I just want to say right off the top that it's a privilege to be among so many people who are passionate about poverty reduction and coming at it from so many different perspectives. But I firmly believe that any discussion of health outcomes, food security, and poverty reduction in Newfoundland and Labrador has to include the role that our minimum wage rate plays in all of that. And so I'm thankful for the invitation to do so today. All but 2 of my first 18 years of life was spent living below the poverty line, sometimes in abject poverty. And I was well aware of this reality growing up. I did not live in a community where there was a lot of poor people. I lived in neighborhoods in Vancouver and Toronto that, you know, my classmates, I didn't have classmates who were poor like I was. And so I was I just had this strong sense as a child that there were 2 kinds of people who had money for things and people like me and my family. So my definition of poverty is quite simple. If one does not have enough income to provide for the basic necessities of life and participate in society the way that others do, one is living in poverty. So when I was living in Toronto, the Toronto area with my dad, he was a low-income worker and just did not have enough income to support his family. When I was living in Vancouver with my mom, the income support levels that she received were not sufficient to meet our needs. And we ran out of money every single month. So I strongly feel that we address that problem of insufficient income and we address a good chunk of the poverty. Now, I know on that front, there is much discussion these days around the benefits of a UBI or a GLI and the reduction or even elimination of poverty. And I know, judging by the comments that I've seen in the chat today, there's lots of people here who hold that view. And I don't want to denigrate any of those who are advocating for this or pushing forward for the government to do this, but I do need to declare that I am skeptical. And a big part of the reason that I'm skeptical is that we already have programs in place right now. Programs in place right now that would lift people, a number of people anyway, out of poverty if the political will was there to do so. Admittedly, some of these programs are federal jurisdiction, so I'm just going to leave those aside, but some of these are provincial in jurisdiction. And in fact, Sarah, in her presentation this morning, touched upon a couple of these that I would like to draw attention to. One is our income support program. I'm not an expert in this, but I'm just going to point this out because it did impact me as a child. So our income support program, a provincial program, which provides income to people who are unable to work, but unfortunately provides insufficient income. I believe the rates are below all 3 national poverty benchmarks. And I know in my work as a parish priest with people on income support, I was absolutely appalled at how little they had to make ends meet. It was shocking. And we could change that today. But we also have legislation by which the provincial government sets the minimum wage that an employer can legally pay their workers. And unfortunately, our current minimum wage is a poverty level wage. And I know there's people who get upset when I talk like that, but that's just the reality. Thursday coming, April 1st, our minimum wage will increase to $12.50 an hour. So a person working 40 hours a week for that $12.50 an hour, 52 weeks a year, is going to earn a grand total of $26,000 a year. Imagine trying to live on that. Let's just take an example. A single person living in St. John's, nobody dependent on them, just taking care of themselves. So that single person living in St. John's on that $26,000 a year is going to pay between 50 and 60% of their take-home pay just for rent of a one-bedroom apartment. That is way over the widely accepted 30% benchmark for shelter costs. So imagine trying to support a family on that. And yes, there are families trying to get by on minimum wage in this province. And we could change all of that today. We could change all of that today. And I can tell you that this ties into the other things we've talked about, because I know from my childhood experience, you don't pay your rent, you get evicted. You don't pay your heat and lights, it gets cut off. Where you do have your wiggle room is with food, groceries. And I can tell you, I never want to go back to eating the way that I had to eat as a child. And I still bear health consequences from that to this day. Now, our polling shows that there is significant support for a $15 minimum wage in Newfoundland and Labrador. 68% of respondents, so over 2/3 of the population, support a $15 minimum wage, like without condition. And that number goes up to 91% if we include the people who somewhat support a $15 minimum wage. So it's not a matter of this not being a popular policy with the public, it's just a matter of political will. And I would point out that $15 an hour is not a living wage, right? But it would lift a number of people out of poverty in this province. And our minimum wage negatively affects a lot of people in this province. There are some who would confine this conversation to minimum wage workers themselves, but we actually need to talk about it in terms of low wage workers. And in this province, the Newfoundland and Labrador Statistics Agency defines a low wage worker as someone earning $15 an hour or less. And the last year that I have statistics for is 2019. In 2019, there were 48,900 low-wage workers in this province. So that means that almost 1 in 4 workers in Newfoundland and Labrador, 23% of our workforce, earns $31,200 a year or less. And the overwhelming majority would be less. And this, I say to you, has far-reaching implications, negative repercussions for the province as a whole, both in dollars and cents and in human costs. So if, Sarah was talking this morning about food insecurity and the significant role that a lack of income or insufficient income plays in our much higher rates of food insecurity in this province, and she clearly identified a living wage and increased income support levels would be a prime way of addressing those. And food security itself is one of the social determinants of health outcomes. And income is widely regarded as the #1 social determinants of health outcomes. And so this, I know we're not talking about everybody's income problems when we're talking about the minimum wage rate in this province, but it's a significant number of them. and we address that, and it's a key component in a larger, more comprehensive poverty reduction strategy. So again, if we are going to have a comprehensive poverty reduction strategy, I would strongly argue that our poverty level minimum wage must be addressed in that strategy. And I'll leave it there. Thank you very much.
Thank you, Mark. Really appreciate how neatly you have tied a number of significant issues that both Ed and Scott raised in terms of income support, access to pharmacare benefits that enable people to continue working in case of chronic illness or disability, but also looking at what our needs are in terms of shelter, heat and light, those amenities, along with being able to choose good quality, acceptable, culturally responsive, relevant food choices. So we have some time to engage in a discussion between Mark, Ed, and Scott. And I think I'll start with Scott and ask you to reflect on what you heard from Mark and Ed.
Yeah, thanks, Mark and Ed. Great. I think we're going in the right direction. I think that we've been doing a series of national conversations over the month of February and March. We've had 11 of them. We have one on gender tomorrow, disability on Wednesday, and kind of systems thinking on Thursday. But we overwhelmingly heard that none of it works until all of it works. So, which is kind of, it's daunting. But I was pleased to hear that the government had committed to a universal national pharmacare program in the Throne speech in the fall. So I think implementation is going to be the key. Ed, I think you probably agree. How it's implemented is going to be the key. What the formulary is, what the catastrophic drug coverage is. That's going to be something. With the minimum wage, I think that the last recommendation of our report this year was that the federal government and provincial governments figure themselves out so that every member of everybody in Canada gets at least the market basket measure in their community. So the market basket measure for St. John's is $45,000 annually, for $45,434. So between provincial transfers and federal transfers, if that would be the kind of table stakes, then I think that a lot of the questions you're bringing up around minimum wage will be answered. And you're absolutely right. Minimum wage enables so many other things. It enables higher income assistance rates because that's what the ceiling for. They always put on the income assistance. Well, we can't go above minimum wage because people won't work. I think that you're taking a lot of maybe social liberty on why people work. I think a lot of people work for purpose and fulfillment, and not only for the money. And I think that speaking to a lot of people in the nonprofit sector, you're doing great work, caring work, and of the caring economy, and you're not being probably well remunerated to the level of your care or the level of your ability. So I think that's a great example. I think there's only 2 provinces in Canada that have a $15 minimum wage. Alberta has it for everybody, and Ontario has it for home support workers. So I think that, and you'd be a few dollars more than the Atlantic average, which they also like to put in people's faces. So we can't have it because it's above the Atlantic average, which I'm not sure why that's a limiting factor. But it seems to be something they bring out quite often. I think that we saw it, and I see in the comments they mentioned the CERB, and they've put it forward that $2,000 was what it would take to live through the pandemic for individuals. Yet we have so many individuals in Canada that are living through daily lives and the pandemic on so far less on social assistance. And so I think I'll leave it there, but I think there's some work to do with that coordination between levels of government, and hopefully we can find a way that we could there's no silver bullets, and there's no there's no like one solution because it all has to work. It has to be pharmacare, has to be universal childcare, it has to be, food security, it has to be housing, affordable housing. It's got to be like supported homelessness efforts. It's got to be all those things at once. It's got to be health equity. It's got to be, Black Lives Matter. It's got to be, Asian, get rid of Asian hatred. There's a whole bunch of things that are going on, but they're all going on at the same time now. And I think that there's kind of a big tsunami of purpose. And if we can kind of use that to kind of not to reform the systems, but to create the systems that work for the people, then I think that we're probably on a good path.
Thank you, Scott. I think your point about looking at those different perspectives and how they intersect, not as an additive component of experience, but how they can alter or change how we develop policy, how we engage with people in determining solutions that work best in different contexts. And I'm wondering, Ed, if you have some thoughts that you'd like to share on what you've heard so far.
It's good. I support a living wage. I also believe that it should be $15, at least at the beginning. I believe that some of the other participants mentioned about dental care and housing, and there's a lot of issues to be dealt with, but I feel pharmacare is absolute importance because it can or does affect all of us one way or the other. The thing is that too many people are doing without, as the demographics here in Newfoundland. I think Sister Elizabeth Davis, if that's her correct name, brought up a lot of points. Our population is getting older. We're going to be seniors. I'm 60 right now. So we need things like pharmacare to help us, especially as you get older. Obviously, people are prone to illnesses and all that, as other groups are as well. The thing is that I really think basic livable income and pharmacare are the two top priorities in this country. I'm not saying others aren't, but you got to, like I said before, you got to start somewhere. And, the thing is that I'm really trying to be positive with pharmacare because I know it's been decades since it was first brought up, right at the time in the mid-1960s when, when Medicare was introduced in this country. And we've had studies, we had commissions, we had committees, consultations, so on and so forth, including the recent one by Dr. Eric Hoskins in about 15 years ago. The former federal government brought in the 2004 Health Accord, and also the National Pharmaceutical Strategy. But as it turns out, all that effort and advocating and all that, we still don't have pharmacare. And it's really unfortunate, that there are 9 million Canadians, approximately 9 million Canadians who don't have any public or private insurance coverage for their meds, or whatever coverage they have is inadequate. In other words, for some people, even with co-pays, deductibles, insurance premiums, cap limits, all that stuff deters people from getting the medication that they need on a day-to-day basis. I just hope the government in power in Ottawa with the provinces and territories implements pharmacare soon. That's all I have to say.
Thank you, Ed. Really
Thanks.
appreciate your insights. And I think it is important that not one size fits all. I've heard often that people are not pizzas. You can't choose a creation that will meet everyone's needs at the one time, but we need to have some variety and some different kinds of options. Also seeing in the comments that people are highlighting other issues in terms of dental care, other supports that people use to keep themselves healthy are not part of our healthcare system. So that also adds to the challenges. Before we move into the next session on discussing today's highlights and insights, Mark, I wanted to ask you if you had any other additional comments that you wanted to share with us, reflecting on Ed and Scott's previous comments.
Well, I certainly agree with what Scott has to say, that there's like many moving parts to any kind of poverty reduction strategy. I mean, he well illustrated that in his words. And, you know, I acknowledge that, and that the piece I'm speaking to is but one cog in a bigger machine. And with respect to what Ed's been talking about with universal pharmacare, I want to add something to that I'm not sure, you might have mentioned it, Ed, but I might have missed it. But, you know, growing up in poverty as I did, it would have been worse if we didn't have universal publicly funded healthcare. I got sick, I went to the doctor, I went to the hospital, there was no bill. And I didn't have to whip out a poverty card in order to have that be free. It was free for everybody. So there was no stigma for me to avail of universal publicly funded healthcare, the same as a wealthy person. So that was like a positive to living in Canada.
That's
So
good.
when Ed's, you know, fighting for universal pharmacare, that would be another positive. I don't have to whip out the drug card or whatever to get my prescriptions. Everybody gets it. And so there's no like, hey, I'm poor kind of sign. Head. And I think that's really important, because I know the stigma of being that poor kid, like it still plays out today. So like for human dignity, let's take away the stigma, and the universal programs that you're talking about is really important to that. The only thing I want to say is that Ed was talking about UBI being a good place to start. I'm not opposed to a UBI. I just need to see the details of how that's going to work out. But as for a good place to start, I would argue it's with the programs in place right now. Start with that until such time as we develop a framework for UBI or GLI, whatever we're going to call it. And so that we're actually doing something now, because people are going hungry right now. Right, as we're talking, as we're having this conference, however long it's going to take to get a UBI in place, right now we have the tools in our toolkit right now for provincial governments and federal government to address and reduce poverty. So I'll leave it at that.
Well, I think that's a really important place, Mark, that, you know, the short-term, medium and long-term view are things that we need to think about. We talked this morning in our land acknowledgement about the 7 generations forward. So that's a really long view, but there are, as Debbie and as Sarah and Ivan mentioned, there are small steps we can take to seek improvements. And today's session, to be able to hear people's shared experiences and to learn from the insights you've gained with us here, I think is really important. I'm conscious of time, and I want to make sure that people do have a chance to participate in the small breakout groups. What I'm going to do now is our tech person, Curtis, is going to create breakout rooms. There will be 4 facilitators, 1 per each room, and you'll have a series of questions to think about and address. Really appreciate that if you are not comfortable in speaking on a camera, you can turn your camera off. If you're not comfortable speaking at all, but certainly feel free to share your thoughts in the chat. We are keeping track, and the insights you've been sharing have been incredibly valuable and useful because I've been using them to help guide some of the conversations today. So I thank you for that. And when we come back at 3:15, we'll have some summary highlights and then a review of our next steps. And Curtis is making things happen, so I'll take time for a quick thank you to our ASL interpreters today. Much appreciate Heather and Danica this afternoon, and Dana and Sheila this morning. So thank you for that. And over to you, Curtis. Thank you, everyone. I'm waiting until all of us are back in the room. And I think we're all back now. Just going to check with Curtis.
Quite exciting to get thrown into a room and back.
It's a bit disconcerting. I feel like I'm in Star Trek and I'm going in the transporter beam.
Transport, yeah.
So it never seems that we have enough time, and yet the conversation and the insights have been so incredibly rich. Really appreciate what people were sharing in the group that I was in. I'm going to ask now for our 4 facilitators to give us a highlight from each group. And I'll go in turn. There's 4: Christine Snow, Taylor Barry, Katie Van Kufnet, and Susan Kelly. I thank you for your work in trying to collect all the ideas that we've had today. So can we start with Christine, please? Christine Snow. Christine, you're on mute.
Okay, hear me now? Yes. Okay, I'm going to start with an aha moment and link that to an action. We've talked lots of different topic areas, but at the end of the day, there was discussion around not a lot of the right voices being at the table, that the time for getting people, all groups of people, governments, community, individuals, to come together because, you know, the need to create more social cohesion. It's an all-in problem. It's a huge problem. Lots of conversation around the problem is huge, recognizing the financial challenges. Where do you take the first bite? One of the actions that came out of that aha moment for a lot of people in our group was the need to facilitate a conversation with government with people with lived experiences, so you can get that perspective on government policy and the impact that it has on people and the needs that we need going forward. A couple of the other things we talked about was the importance of education and awareness, both for different segments of the population that are really struggling with education and training, youth being one that was identified, the importance of education for healthy lifestyles as an action for people to have a look at. One of the items we talked about learning more about, talked about the whole, several times it was brought up about the news item a couple of months ago about the US company and hired to do some work around health expenditures. There was some conversation about that, but that probably kind of summarizes some of the key points that we talked about.
Thank you, Christine. And I should remind people that we are going to be producing a report. So even though we're giving a capsule summary right now and only just giving you a slight taste, we will be having a more comprehensive document. Can I ask Taylor Barry, please, to report on your group?
Hi. Yeah, so there's a lot of really good conversation in my group, but the key points were a lot of like more solutions instead of problems, or like discussing more solutions instead of problems. One of the participants talked a lot about the disability tax credit and educating more people on the disability tax credit. Putting pressure to keep the poverty reduction strategy. Youth engagement was a big one. Women needing to take more control for political engagement. What else? The issue, this was actually a really good one. Issues need to be like for all branches of government. So all branches of government need to be accountable for these issues that we were discussing. Housing was something that people thought we were missing, addressing more people with housing issues when it came to all the topics, so pharmacare, poverty, and such. And so changing policies from the ground up, so starting from the bottom and working our way up so that things change more effectively. And yeah, that was pretty much it.
You sound like you covered a lot of ground in your group. Thank you, Taylor. I'll now ask for Katie Van Kufnet to speak, please.
So we talked about a number of different things as well in our group. Started out talking about pharmacare, including kind of clarifying what the situation is, and talking about how savings in pharmacare, as one example, could potentially go towards other poverty reducing initiatives. We talked about how the timing of a lot of different things, especially in Newfoundland and Labrador, is lining up in a really interesting way. That the health accord and poverty reduction strategy and COVID recovery and new administration and all of these things are sort of short, medium, and long-term issues, but they're all really aligned as an opportunity right now that can be taken and sort of ran with. We talked about the interconnectedness of all of the different issues that arose today. Anytime one topic was being talked about, people were kind of drawing in all of the other ones almost by accident. So all of the different issues of poverty really are linked and need to be addressed as a unit, as well as individually, and that they are often individualized and kind of siloed off in government. There was a comment about how the government tends to come together in multiple different departments sort of on a project by project basis, and that there may be an opportunity for different departments to come together on a more permanent or more regular basis instead of coming for one issue and then disbanding and then coming back together at a later time. We talked about the messaging of poverty as being so connected to health, and with health and healthcare being kind of a primary issue for a lot of people when they think about issues politically. A main election issue for a lot of people is that healthcare is the most important thing. So noting that poverty and health are kind of inextricably linked can help keep poverty as help it keep its traction as being a really important public and political issue now and into the future. And then we noted that a poverty lens on things is important in the same way that the health-based lens was discussed today. That looking at anything with a poverty lens is important to do and can be really useful and should be used in all sort of policy moving forward. And also being sure to not lose a gender-based lens, which is something that wasn't brought up very much today, but still is a really important perspective to keep for all of the issues that were risen today and that are linked towards lots of other things. And various other little pockets that we talked about. It was a great conversation with the group.
Thank you, Katie. It certainly does sound it. And I think the idea of various lenses is an important one to bring out. So thanks for that. Now I'd like to ask for our last group, and that was facilitated by Susan Kelly, please. Oh, I have you on, you're on mute.
Sorry. We had a big discussion as well. Some of the things that came up, we talked about the social determinants of health, and how there's a public stigma of income support and how that's been addressed today. It needs to do, we need to change that. There's also a recognition that, it's time for action. We've learned and we've talked and we've discussed and we've written reports, and now it's time for some visible change. So we did get to some of the suggestions for that. But before we get to those, we talked about learning about, why do we have poverty and who is benefiting, and is there changes that need to happen in relation to that. There was discussion about education in schools around poverty and poverty reduction and what the school curriculum can do to support poverty reduction. We had one really excellent comment that poverty is the erosion of human potential, talking about cultural richness and the value of a person. So some really interesting thoughts there and perspectives. And then when we moved on to talk about the actions that we can take, it's addressed that it's a provincial and national issue that needs to be solved. Some very basic actions is increasing income in whatever way that might look, whether it's social assistance or wages, supporting small businesses so that people can live and earn a wage and earn a living in their communities. That was a point that was brought up. And also creating meaningful and viable employment for folks. Also, we had a discussion about keeping our feet to the fire and the fact that this poverty reduction strategy in Newfoundland is, as old as it is, and keeping the momentum there to actually see some change. Then our discussion kind of turned into talking about the dangers of Band-Aid funding and Band-Aid services and programs, and how social organizations are serving the population, but the cost of administering poverty was brought up. So if folks didn't need to access those services as much as they do, then costs would go down. So I think that might clue up. There was a lot of good discussion.
Thank you, Susan. It's a big challenge always to summarize a very rich discussion, and looking at the people who have come today, we know we always have good ideas to share and insights to offer. So I thank you all for that. We're nearing the end of our day, and I just want to offer you some reflections to kind of pull together the themes. I think it's really interesting that we start off on our morning in some ways a bit theoretical in looking at what is the impact of digital technology, looking at the health accord and the intersections of the social determinants of health, and understanding how research, data, and lived experience help inform our understanding of these issues and also help mobilize us for change. And I think what we heard from Sarah, Ivan, and Debbie around the power of community action, looking at those small steps fueled by passion, and how we can harness the collective energy in our communities. I think what really came across for me today was the importance of a shared vision that's informed by not everyone thinking the same, but our diverse experiences, be they lived, our cultures, our geography, our gendered experiences in society, and so on. And I think this afternoon, and being able to look a little bit more closely at some of the particulars around some aspects, for example, farmer care or food security, we will have some options to think about in the future. So I want to thank everyone for their attention, and to close out our day, I'm going to call on Penny Rowe, the CEO of the Community Sector Council. But thank you for your attention, and also thank you to Heather, Danica, Dana, and Sheila for their interpretation, and Curtis for his tech support. It's been invaluable. Working with tech can pose its own challenges, but I appreciate your contributions and your patience. Penny, over to you.
Today, and to make sure that collectively we actually find a way to make sure that the energy, the commitment, the ideas, the whole wide range of ideas, from small things that we can each do to make change to those big systemic opportunities that we need to take hold of, but how important it will be to make sure that we keep this conversation in the public domain. We do have a commitment from our new administration, which is one step in the right direction, to lead the development of a renewed poverty reduction strategy, and that will be done in consultation with many people across the province. I think the challenge for CSC and organizations like ours will be to find ways to engage everybody in that conversation, so that in fact we do have the wide range of views and possibilities that we can be working with. And one final point, I recall when I was first involved in the late 70s in looking at poverty measures and how we actually can figure out where we are in terms of poverty reduction and addressing poverty in Canada. At the end of that very wide nationwide conversation, we concluded, and I think it's still relevant, that as long as you cannot fully participate in your community and in the world that you live in our society, then you're living in poverty. So I think we need to really focus on what is it we need to do to enable everybody to have the capacity to participate. And I think that needs to be the hue and cry that we bring forward, and the battle cry that we all stand behind, that it's important for everybody to be able to participate in whatever way they need to have the wherewithal, whether it's drug programs, whether it's income, whether it's good housing, to make sure that they're full participants in our community.
Thank you, Penny, and thank you, everyone. As we said earlier, we are going to be preparing a report. We will be sharing recordings of the speakers from today's sessions. Thank you again for participating. It's a new and different world we're living in, and we're working in new and different ways. Really appreciate your contributions. Be well and stay well. Thank you.
Thank you, Martha, for facilitating so well for us too.
Thank you.
Thank you all.
Great day. Bye.
Bye.